If you have been living with knee pain for months and years, you have not been able to find any kind of permanent solution for it, and you are looking for a permanent solution, then this video is for you. So at Apex Hospital, we now perform a knee replacement surgery with a robotic system, which is a USFDA-approved CORI Robotic System. So what makes it different from a conventional knee replacement surgery? That's what we are going to discuss today. I am Dr. Himanshu Kichad. I am a robotic joint replacement surgeon at Apex Hospital, Malviya Nagar, Jaipur. In traditional knee replacement surgery, everything depends on the measurements which you take with the help of instruments during surgery. Whereas in robotic knee replacement, what we do is we get a 3D picture of your knee and then we make it more suitable for your alignment. Means it's more of a customized knee replacement surgery. What are the biggest advantages? That there will be minimal soft tissue cut, there will be minimal bone loss, and all the ligaments which are around the knee, they will not be touched or damaged in any way. Only the damaged cartilage will be removed and it will be replaced with the implant. One more biggest advantage of robotic knee replacement in this surgery is that we get an accurate, almost 100% perfect alignment by the robotic system, and we can confirm it on the table itself that this is what we have planned and this is what we have achieved. So there are no chances of getting any confused that what we have achieved or what we have planned are same or not. Most of the robotic knee replacement system, what they do is they take CT scan of your knee before surgery. You will be asked to go for a CT scan, then they will make a CT scan picture of your knee. Whereas in CORI Robotic, you are not required to undergo any kind of CT scan. So you will not be exposed to any undue X-ray exposure. One CT scan is almost equal to 300 to 500 X-rays. So you are prevented from those X-ray exposures. So this is one more biggest advantage of our robotic CORI system. Then coming to the patient's part, means you must be thinking, okay, so how it will help you? The biggest advantage of robotic knee replacement is that the recovery is very fast. You can walk next day or same day even in the evening. You will be able to sit with knee range almost 90 degree by the second day, and by the third day you can go home and do stairs and everything, all those kind of things. All you need to do is contact us, meet us. If you have been advised knee replacement surgery and if you are confused that should I go for robotic, should I go for conventional, then you can consult with us at Apex Hospital, Malviya Nagar.